or false? A home pregnancy test can give a false positive if you wait too long to check the results. Answer: true. If the urine evaporates from the test strip, the color may change to show a positive result, even if you aren't pregnant. Sadly, Dawn Pennell's dreams of bearing children were extinguished when she was just 19 years old.
I can't get pregnant?
She was diagnosed with polycystic ovarian syndrome that made it virtually impossible for her to get pregnant.
Nothing would ever come about that I could become the mom that I wanted to be.
So at the age of 34, when Dawn starts experiencing mood swings, digestive problems, and weight gain, she attributes it to stress from her continuing unemployment.
The changes in my weight, I could base it on being depressed.
Now, after 8 months of not feeling well, Dawn is in the emergency room with excruciating stomach pains.
When did your last menstrual cycle start?
I don't even know. It's been irregular.
Since Dawn has been diagnosed as infertile, neither Dawn nor the doctor suspect pregnancy.
Hi, guys. Hey. Okay, so the good news is you do not have kidney failure.
And he said that it's a muscle mass in my left side of my back.
All right, you guys. Thanks so much. Appreciate it.
The doctor discharges Dawn, prescribing painkillers for an irritated muscle in her back. But 2 days later, on Friday the 13th, Dawn's condition takes a terrifying turn.
I've never seen a person in more pain.
Ow! I couldn't sit, I couldn't stand, I couldn't lay, I couldn't do nothing.
So we went to the only person we thought would be Dr. Jeff Vendsel, our chiropractor.
I hear you're not doing so well. Tell me kind of what's going on.
A lot of pain on the left side, concentrated like right here.
I was assuming that the psoas muscle, especially on the left side, was really, really tight on her.
What I'd like to do today is go ahead and give you an adjustment and see if I can bring you some relief that way.
Okay.
Tell me if it's too hard.
He said, okay, well, we're getting a little bit better.
But the relief is short-lived.
Ow.
The pain was not getting any better, it was getting much worse.
I can't take it anymore.
Dr. Vendsel wonders if Dawn's body may have reacted to her last adjustment and possibly caused a bowel obstruction due to nerve root pressure in her lower back.
She really hadn't had a consistent bowel movement in approximately a week's period of time. And I said, perhaps utilizing an enema may do something to break everything loose.
I got a suppository and inserted it. She laid back down. Probably a half hour later, all of a sudden she goes, I'm finally feeling something.
Honey's ready.
I'm scared, nervous, panicking.
Kate? I feel like I have to push.
And he goes, baby, push it. And I said, okay. The pain was just unbearable. I felt like my insides were coming out. So I pushed it out, and I was just yelling and screaming that I had relief. Finally, the pain was gone. Hallelujah.
Oh my gosh.
And I was just about ready to get up to go back to bed when I heard a cry.
You hear that?
Hear what?
And I said, hear what?
And I said, I heard a cry. I said, are the coyotes running hard tonight?
I don't hear it.
So we sat there, and I heard a cry. And I stood up from the toilet, and I looked down. And there was my little girl laying in the toilet looking at me.
Dawn's water must have broken while she was on the toilet, where she managed to give birth without an epidural or any other pain medication.
I gotcha.
Miraculously, the 6-pound baby is breathing.
Call 911, Keith.
Okay.
The umbilical cord came loose, and so I wrapped it up and I just held her tight and told her that I loved her.
She's gonna be okay?
At the point when we got to the hospital, she wasn't breathing properly. So they had went ahead and put her in an oxygen tank.
Doctors determined that the baby is 5 weeks premature. To make matters worse, she is dangerously ill.
I do wish I would have known I was pregnant. I just know something was wrong with her.
If Dawn had known she was pregnant, she would have had prenatal testing, and they would have found that she was positive for Group B strep bacteria, which, if not treated, can make an infant very sick and can even cause death.
Group B streptococcus, which is carried in the vagina of many women, it can be passed on to the baby during delivery and cause acute infection.
Doctors would have treated Dawn with an antibiotic to prevent the bacteria from infecting her newborn. Not knowing she was pregnant and delivering at home has threatened her baby's life.
The strep virus that I had, unfortunately, was passed on to her. So she was given antibiotics every morning and every evening in the NICU.
Finally, after 10 days in the NICU, Ariel Pennell is healthy enough to go home. Miraculously, she suffered no permanent damage from the strep infection.
I know what's happening.
So how is it that Dawn never knew she was pregnant?
I wrote it up to getting the devastating news that I would never be able to bear a child, and you never saw the baby bump.
Oh my goodness.
Dawn's period was practically non-existent throughout her pregnancy.
When my coworkers or my friends ask me, how the heck did you guys not know this? I tell them that Dawn never had a normal period in her life, so nothing ever even triggered.
Even in women who rarely have menstrual cycles, they do ovulate from time to time, and as long as they have intercourse around that time, they can get pregnant.
Dawn most likely conceived in May, shortly after becoming unemployed. Dawn was told at 19 that it was impossible for her to get pregnant, so when she experienced mood swings, food cravings, weight gain, and even movement in her stomach, she blamed it on the stress of unemployment.
They always say you have signs, you always know that you are, but I still can't explain why I didn't know.
A woman being overweight can mask the signs of pregnancy. She may not notice protrusion of the abdomen as the uterus is growing, and she may feel the movement of the baby less than someone who's normal weight.
How could doctors have missed her pregnancy? Perhaps Dawn's history of infertility is what threw them off track. Dr. Vendsel, Dawn's chiropractor, also relied on his knowledge of Dawn's health history. Fortunately, the adjustments were in no way damaging to Dawn or the baby. Had he known Dawn was pregnant, he would have simply changed the position of her treatment to make her more comfortable.
The possible bowel obstruction that I palpated and a slight movement of it could have been the baby turning and dropping into the birth canal. It all made sense after the fact.
After Ariel's birth, Dawn experiences another medical surprise.
I'm now a normal 28-day menstrual cycle woman.
It's not completely understood why that happens, but it's thought to be sort of a resetting of the mechanisms that drive ovulation, which come from the brain and then go down to the ovaries.
The song When We Got Married were the maids, I was the maids when I met her. And it all started again in my head at 10:37 on Friday the 13th when she gave birth to our beautiful daughter. Do you know what that is?
A door.
2.5 years later, Ariel Pennell shows no signs of trauma from her dramatic arrival.
There's a reason Ariel was here.
I could finally be a mom. One of my goals in life. To be a mom to my own child.
What's the other two colors?
I felt love and just utter happiness, all wrapped up in one.